Hey lovelies, welcome back to In Her Strength podcast. It's your host Vivian Wogo. If you're seeing me for the first time, don't make it your last. I want us to talk about menopause, early menopause in cancer treatment. Shall we? I'm bringing up this topic because of you sisters and mother-in-laws who fight cancer patients because you assume that once they have been diagnosed of cancer and go through the treatment, they are automatically barren. And so what? Anyways, that's not the case, but and so what? Women do not owe you babies. All right, so welcome back. This is a topic that is some kind of a concern to families and young people. And in my case, I am currently going through menopause, early menopause. When it comes to chemotherapy destroys the eggs and the follicles in your reproductive system and makes it difficult for you to produce eggs. Now, if you decide that okay, you're over 50 and you want to just get rid of your ovaries, that's automatic menopause because you can't produce eggs anymore. But if it is caused by chemotherapy, there are things that you should know. And one of them is that it might be permanent, it might not be permanent. And with the improvements that are in healthcare now, I'm talking from the perspective of a nurse and also a patient, because I have had a conversation with my consultant and she let me know that there are improvements. In my case, apart from the fact that I had my eggs harvested and stored somewhere, it does not mean that I am sterile. That I'm going through menopause now does not mean that I am going to be sterile for forever. It just means that in this period of my treatment, I might not be able to get pregnant. And it is not even advisable for me to get pregnant at this point, because if I do, the child is going to be deformed because the chemotherapy destroys rapid developing cells. So a baby is a rapid developing cell and you don't want to have a baby that has been destroyed by chemotherapy. Who wants that? I don't want that, do you? But that does not mean that I am going to be sterile forever. It only means that it is temporary. It is happening now. Why? Because there are improvements in healthcare, and in my situation, there is a medication I am on, right? There's a medication that my doctor placed me on, which protects my eggs. According to the explanation, this medication forms some kind of coating around my eggs to prevent the chemotherapy from penetrating and destroying my follicles. While the chemotherapy drug is going through my system and destroying rapid developing cells, it will not touch my follicles. The medication will protect it and put it to sleep so I can't get pregnant. Putting it to sleep means that the follicles will not develop, and they will not develop up enough to be hatched into my fallopian tube and then for a sperm to fertilize it. Now, after a long time, in my case, maybe 5 years, then I can now try to get pregnant. That is, if I don't want other alternatives of maybe surrogacy, or I don't even want a child at all. All right. This is for natural conception. But should in case I decide that after 2 years, I want to have a child, I think 2 years for me, yeah, according to my doctor. After 2 years, and I decide that I want to have a child, what will happen is that I can go for IVF. I don't have to wait for the follicles in my womb to go back to normal and start forming for me to get pregnant. Do you understand it? Let me reiterate, right? Now, when you're going through chemotherapy, it means that chemotherapy is likely to destroy your follicles. But with the recent improvements in healthcare right now, there are medications that can be incorporated into your treatment that will protect your fertility. Protecting your fertility is it will put your follicles to sleep, in the sense that your follicles will not mature enough to hatch to the point of getting fertilized by sperm. It means that there is no formation of a follicle for you. And that is why your period disappears. Because what is menstruation? Menstruation is when the eggs are not able to be fertilized. So it melts into the uterus. And when the uterus did not see any baby to carry, it flows out. Now, if there is no egg that is formed and extracted or transported into the fallopian tube, the bed, that is the uterus, will not get ready to receive any child. If it doesn't get ready to receive any child, that means there will be no menstruation, there will be no outflow of blood. Does this make sense? What this medication does, I don't want to mention the name, or should I mention the name? I don't want to mention the name, but what this medication does is that the medication goes to put your follicles to sleep. It's like when a fruit, when a plant is no longer producing fruits. So it makes your follicles to stop growing. And when it stops growing, it has a ripple effect, which is that your uterus will not get ready to receive any child. And if your uterus is not ready to get any child, there will be no menstruation. But this is temporary. After your treatment and when you are ready, when I think after 5 years, you need to take this medication after 5 years to enable your system cleanse completely all the everything that is in your body. Then your follicles can resume functioning. And when it resumes functioning, it means that your menstruation starts again. Does this make sense? Yes, there is early menopause when it comes to treatment, and yes, this is what happens to your fertility. It puts it asleep, but it doesn't take it away from you permanently. Now, what happens during this menopausal phase? One of the things that you're going to be experiencing, that I experience every time, is hot flushes, right? And it was a good thing that I cut my hair, because at some point I just could no longer handle it. When I get hot flushes like this, I'm just hot from head to toe. And it's not something that fan can just handle, because the heat is not from outside, the heat is from inside. You feel like throwing off everything. It's like this minute you are hot, next minute you're cold. And this goes on for a while. Mine is fading off. I still get hot flushes, but not as frequent as I used to. Previously, it used to be almost every 5 minutes, but now I think it's in hours. So this also fizzles out, but it is a process that your body goes through. And then other things that comes with this is sleeplessness. There are nights that I don't sleep from 6 a.m. to 6 a.m. From 6 p.m. to 6 a.m. I will not be able to blink an eyelid. I will need to either take a medication to sleep or just watch movies until the next morning. And this was induced by this menopause, this early menopause that I'm talking about. And then one of the things that you can do to help yourself is to try to eat healthy, try to eat more vegetables, to take walks as much as you can. If you're a gym person and you have the strength, you can go to the gym and train your strength, because remember, menopause causes osteoporosis. It causes our bones to get brittle, so you need to exercise more often to help you stay fit and strong. All right. Then what other thing during this menopausal phase is that you get finer. Yes, you get finer. I feel like I got finer with menopause. And yeah, but this is just to enlighten you that you have nothing to worry about. Your fertility can be protected now, unlike previously. In the past, when they used to treat they used to treat cancer. Once they do chemotherapy, it's just gone. It's no longer the case. In my situation, I have an insurance, which is the fact that my eggs were harvested and put in a bank, and then my fertility can return in future. It depends on what I want. If for any reason I don't want to wait for that 5 years before I can resume menstruation and try to get pregnant, which means that I'll be in my 40 somethings, I can opt for IVF. All right. I can wait for after 2 years of treatment, I can opt for IVF and carry my baby, or ask somebody else to carry the baby for me. Either way, there are options. So you are no longer disabled when it comes to fertility. Don't let it bother you. You are not sterile. Send this podcast to your neighbor's mother-in-law, or to your mother-in-law, or to your friend's sister. Those witchy sister-in-laws that won't let people rest. Let them know that it is no longer the case, that your fertility can return. Bear in mind that some doctors or some places are also still very backwards, so they might not have this option, but you have to bring it to their notice so that they find out or they reach out to places where they can get this particular medication I'm talking about. This medication I'm talking about is not just a tablet or an injection. It is more, they give it like an injection, but it's an implant. It's an implant that is put in your stomach and it's left there. So it keeps releasing the hormones. Will I say the hormones or the chemicals that it needs to release to the follicles gradually as time goes on. It keeps doing that, but it lasts for a cycle of, I think, 28-day cycle. You have to take it every month. So while I am still on this treatment, I have to take it every month, and then after my treatment I have to continue taking this injection for the next 5 years, all right, before I can stop it and then try to get pregnant naturally. But if I decide that I want to do IVF before then it's no problem. There are some adjustments that will be made so that in 2 years I can be ready to carry a child. Remember, I'll be ready to carry a child, not to get pregnant naturally. These are two different things. It is very important that you have a conversation with your doctor and understand what your options are and talk to them about your concerns. If you have a partner who is going through treatment currently and you don't have a child or you plan to have children, and it is very important that you discuss your fertility with your doctor so that they can give you that option. In my situation, I've had 3 different consultants in this treatment. The first consultant was the breast surgeon who did the mastectomy for me, and before she went ahead for the surgery, she referred me to a fertility consultant who handled my egg extraction and storage. And then I got referred to another consultant who is the oncologist taking care of my chemotherapy treatment. I don't know if my oncologist is also going to be the one that will handle my radiotherapy, but these are people that are specialized in different fields that are supposed to be involved in your treatment. So if you stay focused on one particular treatment, which is just the surgery, that is not where it ends. After surgery, there is chemical treatment, which is the chemotherapy, and then there is fertility treatment, which you should have done either before surgery or immediately after surgery before you move on to chemotherapy treatment. I hope this makes sense to you. Early menopause is not an easy thing to deal with because it comes with a lot of things like depression. Now, if you have a partner and you are going through this, it is very important that you let them know or you send this video to them so that they can know that you are dealing with something that you have no control over. When my mom was going through menopause, none of us understood what she was dealing with. We had complaints from my dad about my mom just going off on anybody, getting very upset. At some point, I even thought it was a psychiatric problem and I didn't know what to do. I was even thinking that maybe we need to take her to a psychiatric doctor. And she kept going to the hospital. She was only very receptive when I'm around. I was in nursing school then, year 1, but I didn't know that my mom was dealing with menopause. And at some point, all these things calmed down. But when I got to the point where we were taught about menopause, I reflected and said, Jesus Christ, ignorance is a disease, because how did I not know my mom was dealing with this? And the same thing has happened to me. I have seen myself flare up emotionally. I've seen myself fight people that I had no business fighting. I've seen myself get very upset by the most littlest things. I'm naturally an overthinker. I've seen myself put a whole lot of burden on people in my head. You understand? And sometimes some of these things you can't control it. It is just there. So the only thing people close to you can do is to understand that you're dealing with stuff and let you deal with whatever you're dealing with, because you are not in the same headspace with them. Right? Somebody can reject your call because they are in a meeting. You that is dealing with menopause, you're dealing with depression, anxiety, and all these things that comes with menopause. You are thinking he's probably with a woman and it's the woman that rejected the call. And your anger now is not because they rejected your call. Your anger is that it's the woman that rejected your call. Why? Who gave her the right to reject your call? You are already obsessing over nothing. and this person probably even mistakenly rejected your call or is in a meeting. This is what you have to deal with. Sometimes you just don't know what is upsetting you. You are just upset, and then somebody asks you, "Can I keep this spoon here?" You tell them their life and remind them of their history. It is not your fault. It is the menopause that you're dealing with. Other times you get very depressed. You feel like you don't want to talk to anybody. You just shut down. You don't answer calls. You don't respond to messages. This I have done. This I have, from time to time, I still find myself doing. It is not your fault. You are going through a phase called menopause. And the worst part of it is that it is premature because you are not even ready for it. There are so many things that are attributed to menopause that we need to pay attention to, both as carers and as patients. Because when we don't pay attention to things like this, it is very, very easy to miss things and assume that somebody has gone crazy, or somebody hates us, or she's not appreciative, she's not grateful for the people she has. No, she is. She just doesn't know what she's dealing with. She doesn't know how to handle it. If you have a partner who is enlightened enough to actually listen to you and understand that what you're dealing with, you have no control over it, you are blessed. If you have people around you who understand the concept of your treatment, who understand that things are out of your own control, even though it is your mouth that is going off, your brain is not working with your mouth at this point, it is a blessing. And if you know anybody that is going through this situation currently, and you don't trust that people around them understand exactly what they're dealing with, send them this audio, send them this video so that they can listen to it and pay attention to the person they are taking care of. It is not their making, it is not their fault. They are not ungrateful. They just don't know how to handle it. And then there is hot flushes, like I said, there is depression, there is sleeplessness. Remember, when you don't even sleep, your anger is already heightened. Then another thing that comes with this thing too, I have noticed, is overeating. And I think that is why I am finer, because I remember that same period that we used to complain that my mom is overly angry and throwing tantrums. My mom added weight. I have never seen my mom that. If you see my mom's bum bum, if you saw my mom's bum bum that time, we were like, so my mom can add weight if you see bum bum. In my case, I don't have bum bum. I don't know where it went, but I sure am not having a lot of clavicles like I used to, and it's because of eating. Eating, it makes me eat in the morning, afternoon, night, midnight. It wakes me up to eat. See, people without knowledge are severely disadvantaged. When I think about my mom's time, it almost causes me to cry, because those times the complaints were out of this world from my dad and my brother, and we actually thought there was something else going on. My mom will wake up in the middle of the night to finish the food in their house, and they'll be complaining that my mom has gone mad and all those things. Little did we know that it was menopause that this one was. People have their normal character. My mom is somebody that does not tolerate nonsense on a normal day, but these ones were overly exaggerated. We thought, finally, this one have gone weary, but we didn't know that it was menopause that she was dealing with. This woman went through this process with no support. I remember one of those days I came back, I was asking, what is wrong with you? Why are you trying to chase everybody away? This woman started crying, and I ignored her because I felt like she has done too much. She started crying, and while she was complaining, she was crying. So I told her, there's no need crying. You are just getting on everybody's nerves. I was talking from not understanding what that woman was going through. And I know that I understand it now because I am a nurse. I have finished studying. And at the point where I learned about menopause, my mom had already gone through this phase. And as every day I keep thinking there is a better way to compensate her. But now I know better, and I'm telling you that you should pay attention, because you never know what that woman is dealing with. Be kind. They've not suddenly gone crazy. They've not been crazy all this while. So what is going on? I think I've overflogged the topic. If you have any more questions about this topic, leave it in the comment section, and share this video with someone that needs to know about menopause during chemotherapy and cancer treatment. It is not to be joked with. In fact, menopause as a whole needs to be talked about. There should be more awareness on that. There should be more touchlight on menopause, because Every time I think about what my mom went through during her own, I she was getting this pain in her knee. She was getting hot flushes, and she will always go to the hospital. The doctors will sometimes I'll see the medications they're giving her is pain relief and B complex that they're giving her. They never mentioned it that this one was dealing with menopause. I will leave school because she won't want to talk to anybody. She doesn't want to go to hospital with anybody else if it's not me. So I will leave school and come back home and go with her to the hospital, because that's the only way she will go to the hospital. And we're going through and fro. I feel like a lot of attention needs to be paid to this particular phase in a woman's life, because I understand well, but this is to the detriment of my own mother, who has gone through this phase with no care, no support, just blame and blame and blame. I don't want to start getting upset. Share this video with people that needs to know more about this. Menopause in general needs to be paid attention to. The woman hasn't suddenly gone crazy. She's just overly emotional and dealing with things that she cannot handle or control. I'll see you in the next episode.